Using the round scalpel handle with the number 15C blade, I'll make 2 vertical release incisions. The first vertical release incision will be made here on the mesial aspect of the tooth, starting above the mucogingival junction, cutting boldly down to the bone with 1 cut, and stabbing it at the very end. Because I'm using this round handle, I can be so much more precise with the incisions. Starting above the mucogingival junction, cutting boldly down to the bone with 1 cut, ending at the distal aspect of the tooth, stabbing in at the very end. Now using the Cindex Periosteal Elevator, I'll begin using the small end of the elevator to begin the periosteal elevation. I'm going to take my time keeping the sharp blade onto the hard tissues the entire time, using small movements here in the cat mouth. Taking my time to gently peel and pry this tissue away from the bone and away from the tooth. Getting the corners peeled away is done nicely by taking the time using this freshly sharpened blade. Once the flap is peeled away, we can begin to see the alveolar crest, and we want to make sure the elevation continues beyond the mucogingival junction. I'll use the larger size of the Cindex Periosteal Elevator to be more efficient with the remaining elevation of the soft tissues away from the bone, making sure that I elevate beyond the mucogingival junction to expose the bone that I want to use the high-speed drill to remove in aiding the extraction of this tooth. I'll use the small side of the periosteal elevator to elevate the soft tissues on the other side of my incision, on the palatal side, prying this tissue away from the bone to help suture retention when we're closing this defect. We'll use the elevator to hold the flap out of the way so that the high-speed drill with the round ball burr doesn't engage the flap and destroy it. We will use the high-speed drill to gently remove some of this bone overlying the buccal aspect of the root. We want to take great care not to cut into the root as we're doing so. We also want to make sure that we remove bone the full width of the root. This is the number 3 winged elevator that I'll hold bulbed handle in the palm of my hand, grasping firmly. And I'll take the freshly sharpened blade, insert it between the root and the bone, pushing in as I oscillate deeper and deeper toward the apex of the root. When I get in and get good purchase, then I can apply gentle twist and hold, applying steady pressure as I apply this to stretch and fatigue the periodontal ligament fibers. I can get more and more penetration by pushing in and oscillating and continuing to hold on the tooth. I want to make sure that I go the entire circumference of the tooth. When we get movement here on the mesial aspect of the tooth and get some penetration, then we can withdraw and go to the opposite circumference of the tooth, working down between the root and the bone on the distal aspect of the root, applying twist and hold. I make sure that I do this all around the entire circumference of the tooth, going deeper and deeper and deeper as we go around the circumference, twisting and holding to help stretch and fatigue the periodontal ligament fibers. When the tooth has been sufficiently loosened, we can take the Ultrema extraction forceps, get a great grip onto the tooth with a little bit of twisting motion, we can then pull out and remove the root from the cat's alveolus. Using the Cindex Periosteal Elevator, we'll go around the palatal side, double checking to make sure that the soft tissue has been elevated from the palatal bone enough so that we can get good suture hold through the periosteum when we're sewing the flap closed. By elevating this soft tissue, we may also expose a sharp ridge of the palatal alveolus, which we can then smooth with our high-speed drill and diamond burr. Using the Cindex Periosteal Elevator, I'll hold the flap out of the way so we can come in with a high-speed drill with a football-shaped medium grit diamond burr on the high-speed handpiece to smooth the roughened bone, making it more comfortable for the flap. Then using the finger to make sure everything feels smooth. Using the micro 1x2 rat tooth delicate forceps, we apply tension to the flap. And then using the Ava Little Feline flap scissor, we put the tips together, we push into the space between the mucosa and the periosteum at the front of the base of the flap, bluntly separating those two layers, making sure that we can separate the mucosa from the periosteum. Once we've separated those two layers, then we open the scissor, insert one blade into the space we've just created, and then we sharply incise the periosteum. We continue that along the base of the flap from one side to the other, bluntly separating mucosa from periosteum, coming back with one blade and incising just the periosteum. It's by bluntly separating the mucosa from the periosteum and sharply incising the periosteum, we free the tension on our flap so that we can permit better closure without any tension. And here the flap has been freed up enough so that it lays over the defect with an overlap and that it stays put. At this point, we know we have properly released the tension using the Ava Little flap scissor. When tension release has been assured, we can then use our Ava Little scissor to trim and debride the margins of our incision. First, trimming a sliver of tissue on the palatal side to make a fresh edge all along the palatal defect. And then using the Ava Little scissor to debride the margin of our flap. Using the serrated edge to take small slivers, not wasting this precious tissue of the cat mouth. At this point, we have enough tension release. We've properly shaped the margin of our flap. We should have great tissue for the final stage of closure of our defect. And now, using the micro rider needle holders, we'll use 5/0 suture material and this smaller, more delicate P3 needle, taking nice bites through the soft tissue, assuring that we get periosteum on both sides of our defect, suturing in simple interrupted pattern. This is the completed suture line. Simple interrupted sutures with apposition of the tissue, so there's no overlapping, there's no inversion of the tissue, and we get good approximation, closing the defect with no tension. We should get great healing from this surgery. Using the pen luxator, we're going deeper down between the root and the bone, cutting periodontal ligament fibers around the entire circumference of the tooth, using great delicacy and finesse to avoid fracturing of these very delicate roots. Because I'm always holding this in the modified pen grasp, I'm not able to apply a lot of force to the tooth, and that's helping to prevent many more fractures of our roots. Another wonderful instrument for the use in feline oral surgery is the Zen Levitator. It has a very small, delicate tip in the cutting blade, and then has the bulbed handle. So when we put the bulb in the palm of our hand and grasp firmly, we then have a lot more power to get even deeper penetration. We apply that work, cutting by oscillating in one action and pushing in with the elevator, continuing the work around the entire circumference of the tooth, driving it deeper and deeper toward the apex of the tooth, making sure that we leave no area of their circumference untouched. The Ultrema extraction forceps, with its smaller stepped jaws, allow for not only the delivery of larger roots such as the canine tooth in the cat, but also for the grip and the removal of smaller teeth such as the incisors or the premolar teeth in the cat. They may be held with the overhand grip, and also they may be held with the fingertip grip, putting the thumb and the forefinger into the fenestration holes on the side of the handle. By using the fingertip grip on these smaller, more delicate teeth, we can apply more of a gentle twisting action to remove these teeth that are loose and to help to prevent fracturing of the roots.